Welcome to the SVG-TV Evening News for Thursday, April 1st, 2021. I'm Khalil Cato with the details. Citizens are being urged to adhere to the existing public health regulations for the long Easter weekend period ahead. Acting Prime Minister Montgomery Daniel said Cabinet was briefed on the COVID-19 situation in the country by officials from the Ministry of Health and has decided that the existing regulations should remain in place for the Easter weekend in light of the ongoing community spread of COVID-19 in the country. Reiterating the government's motto that no one is safe until everyone is safe, the acting Prime Minister said while persons will be tempted to socialize, they are advised to limit their movements and adhere to the public health regulations.
Advising the general public to cease as much as possible the social gatherings, because this is what can lead to the positivity of COVID-19. So the Ministry of Health on the weekend is asking that social gatherings be reduced tremendously, if not at all. If there are going to be social gatherings, of course, the churches would maintain their 1/3 population.
In line with regulations, the acting Prime Minister says there should be no social gatherings, including river cooks, limes, boat rides, picnics, or parties during the weekends.
Ask the van drivers to maintain the capacity as identified by the Ministry of Health. We ask individuals, once you are in a public place, that you wear your mask. And we ask overall to avoid social gatherings to ensure that we have a safe St. Vincent and the Grenadines.
Meanwhile, the Victoria Park vaccination site in Kingstown is expected to be opened on Saturday from 9 a.m. to 12 p.m. Additionally, the Stubbs and Bookament polyclinics will be opened on Saturday, Sunday, and Monday from 8 a.m. to 12 p.m. The Ministry of Health says no vaccine caravans will be held during the Easter weekend. The ministry said the COVID-19 vaccination teams will be observing a period of rest, rejuvenation, and reflection from Good Friday to Easter Monday. The RSVG police force is also urging citizens to adhere to the various public health measures and protocols and to exercise restraint by staying home as far as possible over the long weekend. The force says patrols will be conducted to ensure there is no playing of amplified music in public or private places, no mass gatherings of persons on beaches or other social events, including river cooks, picnics, etc. Social and physical distancing are being practiced. Motorists and commuters are adhering to the protocols with regards to public transportation and the number of passengers riding in omnibuses. No boat rides or excursions, and that quarantined persons remain at their designated places of confinement at all times. Thanking the members of the public for their cooperation and support during this unprecedented period, the RSVG Police Force says it is important that everyone works together to ensure the maintenance of the health and safety and security of SVG. And 2 additional positive cases of COVID-19 were recorded from 129 samples received and tested on March 30th, resulting in a positivity rate of 2.3%. No new recoveries were reported, leaving the total number of recoveries at 1,587. 153 cases are active and 10 persons with COVID-19 have died. 1,750 cases of COVID-19 have been reported in St. Vincent and the Grenadines since March 2020. The public is urged to continue to use masks, sanitize, physically distance, and get vaccinated to reduce the spread of COVID-19 in SVG. St. Vincent and the Grenadines received a further 860 doses of the Russian Sputnik V vaccine last week, a purchase made through funds designated for the purchase of COVID-19 vaccines. According to members of the COVID-19 task force, the SVG COVID-19 task force and infectious disease specialist Dr. Gerald Thompson, of the doses received, 650 persons took the vaccine last weekend, 550 on mainland St. Vincent and 100 in the Grenadines. He said persons He said the persons consisted of healthcare workers and ordinary citizens. The vaccines were administered at the Levi Latham Health Center and the Bookament Bay Polyclinic due to their ability to house the vaccines, which need to be in very cold conditions. Speaking on the growing hesitancy of persons to take the AstraZeneca vaccine, Dr. Thompson said the small number of thermobotic episodes seen in large nations is not indicative of a problem with the vaccine. He noted that hundreds of persons continue to die each day, while ongoing debates about the vaccine continues despite the small number of reports being seen that are still not linked directly to the AstraZeneca vaccine.
There are far more persons dying from the virus itself. And that's sad that the discussion has shifted from the virus to the vaccine. Naturally, that it should do. But persons seem to have forgotten about the dread and the destruction that this virus is doing as a cause of death on a daily basis in these countries. So as some of these countries wait, 500 and so 400 persons are dying each day because they have not received vaccination prior.
The infectious disease specialist added that while vaccines are becoming limited due to vaccine nationalism, the evidence shows that countries that are vaccinating are reporting 0 deaths and cases. He said government has been seeking alternative vaccines and have received 2 refrigerators to assist with their storage. Dr. Thompson expressed concern that persons are becoming relaxed and warned against another spike in cases if protocols are not adhered to. He also shared the growing symptoms of COVID-19 that is affecting a large number of persons who have contracted the virus.
As I've walked around Kingstown, I've noticed more and more people are reducing their protocol, the wearing of masks, or where they're not wearing the mask properly. And this all sets up the situation for another spike. And we've had a community spread. I really want to urge people. People have been saying the virus is like nothing. They're saying that the vaccine is worse than the virus. I want to tell people that is absolutely not true. But we're now finding out that this virus not only is inducing long COVID problems, it's triggering new onset diabetes and causing brain fog. We're now finding in men it's causing erectile dysfunction. It's 3 times the rate as normal. And so we are finding new symptoms. It's hard to keep up with the new things that this virus is doing. And this virus is bad, and I can't understand why people are deciding to choose to deal with the virus rather than to deal with the vaccine.
With the slow rollout of the national vaccination campaign, one doctor on island said private medical practitioners should be more involved in the exercise, which could result in more persons being vaccinated. In a telephone interview with SVG-TV News, Dr. Junior Aki shared how patients are more at ease in taking the jab once they receive a doctor's recommendation.
Patients have been coming and inquire, and so I have been able as well to dispense the vaccine to patients, whether my patients or not. They seem to say that, doctor, if you tell me I trust you, you know that it is safe, then I'd go ahead and take it. In that way, I think doctors who have patients, the patients trust the doctor. The doctor would let them know about the safety of the vaccine and then go about and advise them that it should be taken so that we can get back on course. So far, I have done about 60 or so, and some more have inquired. So it's good when the private sector can get involved, just like overseas, in helping, because the government may not be able to do it on their own.
He added that while persons do not like to be coerced, he believes more individuals will get vaccinated eventually. He also commented on the adverse effects that are being seen from vaccinations and whether it should affect a person's decision to be vaccinated. Over 10,000 Vincentians have been vaccinated thus far as the government continues its vaccination drive and aims to have at least 70,000 Vincentians take the jab in order to return to some form of normalcy. The government has agreed to again meeting with the various trade unions and other stakeholders to discuss the steps forward in relation to the proposed vaccination and testing policy for the public sector workers, which is expected to take effect on April 5th. This comes after a letter was sent to Acting Prime Minister Montgomery Daniel on behalf of the Public Service Union, the Teachers Union, and the Police Welfare Association, requesting an urgent meeting on the matter. The letter from the unions refers to the proposed approach by the government to institute the policy, which was deemed unreasonable, impractical, arbitrary, and an infringement on the rights of public sector workers. President of the Public Service Union, Elroy Boucher, said he's looking forward to Tuesday's meeting, which will determine their course of action. However, he's hoping for a favorable outcome. SVG-TV News understands that all of the unions have fiercely argued against the proposed policy. On Friday, March 26th, government officials, led by Acting Prime Minister Montgomery Daniel, met with the trade union representatives where details of the policy were outlined. The policy stipulates that all employees of the state who have not been vaccinated are required to be tested regularly for COVID-19 infection once every 2 weeks based on risk levels as determined by the health authorities. It also requires public sector workers who have received their first and/or second dose of an approved COVID-19 vaccine to submit copies of their vaccination records to their respective ministries or departments or agencies by April 7th. SVG-TV News also understands that the Attorney General's advice was requested on the legal implications with respect to non-compliance with the policy. The long Easter weekend commences tomorrow, and it was a busy day in downtown Kingstown today. The possibility of an eruption of the La Soufrière volcano is on the minds of a lot of people who were shopping for essential items, while others were buying codfish and mackerel for the traditional Good Friday meal. Larissa Pugsley-Kidd tells us more in this report.
For the catfish, this young man invested in codfish to sell to persons in capital Kingstown, and his investment seemed to have paid off as there was a rush at his stall with persons trying to purchase the fish product, which makes up the traditional Good Friday meal.
I get good tea. I don't say about $3.
This woman said other than codfish, mackerel is her preferred choice for her Good Friday meal.
Never used to use chicken on Easter. So, make around the legislature, I do that too. Some mackerel, sweet potato, boba yam.
For other vendors, tomatoes and provisions were fast sellers.
Mostly shopping for is the ground provision, the yam and sweet potato mostly.
It was observed that there was less shopping in the stores, and even though there was traffic on Back Street, it was worse on Upper and Lower Bay Streets, where there was crawling traffic for most of the working day. While persons are preparing for their Good Friday meal, there were those, particularly the elderly, who are preparing in the event that there is an explosive eruption of La Soufrière, as they remember the 1979 eruption which took place on a Good Friday 42 years ago. While many of the persons we spoke with today are in the safe zones, they are quite aware they can be impacted if the volcano erupts, and they are preparing for any eventuality.
I have my water already stored, I have my food stuff at my farm, I just make sure I have gas, enough gas to say if I can't go outside, I have a lot of coals.
Even though you have the feet, you have to walk towards the feet. It's to gather some water because I know it will be affected. This thing I had to buy right now is like a tin of biscuit.
This year, for the second time, persons are asked to stay home for the long holiday weekend as SVG remains in a pandemic. Some people said they look forward to spending the quality time with their family.
I love to plant, save, pepper.
I have to stay indoors. I work in land, so I go up in the land and still do something.
For SVG-TV News, Larissa Pugsley-Kidd.
The La Soufrière volcano monitoring team, led by geologist Dr. Richard Robertson, successfully carried out a visual observation of the new lava dome today, which continues to effusively erupt and grow. This was the first visual observation following the swarm of volcano tectonic earthquakes recorded and felt last Tuesday and Wednesday. Professor Robertson told SVG-TV News via a telephone interview that they climbed to the summit of the volcano from the windward side and did not see much change to the new dome, except that it continues to grow laterally around the 1979 dome.
But from the southern front, it has increased slightly, so it's now gone slightly past the the fumarole that existed previously on the 1979 dome. There's understandably a lot of steaming, as has been the case at the interface between the new dome and the old dome, and particularly in the area where the fumarole existed before. But a lot of that is gas. Well, it's really water vapor, water steam, because the underground water is boiling. And the top of the dome where it came out from is really mainly where the volcanic gas is coming. So
the lead monitoring scientist said rock falls were also observed, which were most prevalent on at the center of the dome, which interfaces with the old dome.
One or two rock falls, which is essentially how the dome goes, is by pushing out from the center and is in a kind of conveyor belt mechanism. The material that comes up at the center from where it came out originally eventually reaches to the edge, and it becomes over-steepened, and it falls off as rock falls. We did see one or two rock falls, perhaps not as much as we have seen in other times that we've been up there, but there is rock fall activity continuing, usually very small. Currently, a lot of the rock falls are happening in the area of where the fumarole used to be in the 1979 dome, but they do have some on the southern section too. So the rock fall.
Professor Robertson said this weekend gas specialist Dr. Thomas Christopher will be using the service of the SVG Coast Guard to take gas measurements on the windward and leeward sides of the island. They will be testing for sulfur dioxide.
Below the plume, or below when I say plume, the gas that's been emitted at the summit is again caught up by the wind, and it forms what's called a plume of gas that extends all the way over to the sea. And if there's sufficient of certain kinds of gases in it, and this time we're looking for sulfur dioxide, we'd see it in the plume, and that's one of the things that we'll be looking for. That's one thing. The other thing we'll be doing is that we'd more than likely be going along the leeward trail, some parts of it, to do carbon dioxide measurements in soil. And apart from that, we'll be simply, continue to beef up the procedures at the observatory to make sure we have them tight.
An instrument measuring ground deformation was also retrieved today from the Volcano summit, but according to Dr. Robertson, a drone survey could not be done due to strong winds. He said while he understands the anxiety of Vincentians about history repeating itself of a possible explosive eruption on Good Friday, there is no scientific evidence which suggests this will happen. Victims of cybercrime must take their cases to the court in order to send a strong message to perpetrators. That's the recommendation coming from head of the IT unit of the RSVG Police Force Criminal Investigations Department, Superintendent Croston Francis. Recently, several videos have been circulating on social media with explicit content of a young woman who claimed she was raped and abused by the person whom she claimed was responsible for releasing the videos. There has been much public discussion on the matter, with persons calling on the police to step in. In a telephone interview with SVG-TV News, Superintendent Francis says since the introduction of the Cybercrime Act in 2016, no individual, to his knowledge, has been fully prosecuted under the Act, despite there being heavy penalties attached to the offense.
A lot of ladies in particular, they will come to the police when their blood running high, so to speak. They will come, and then when we get down to talk to them to give the investigation, they will say, listen, I do not want this to go to court, especially those of a pornographic nature. Under the Cybercrime Act, I do not think so. Since I've been here, we haven't had any cases that have gone to court.
Superintendent Francis is encouraging persons who have had images or videos of themselves recorded, published, and circulated on social media or elsewhere without their permission to take the matter to court to have the perpetrators dealt with to the full extent of the law.
We need to send a strong message that the Cybercrime Act exists, and we at CID, we are determined to enforce it. And the penalties are very severe. Summary offenses, when you record and you share sexual activities between you and another person without the other person's consent, it's a serious offense. It's like $100,000 fine. Indictable offenses is much more.
The public is being reminded that recording and sharing of pornographic images or videos of an individual without his or her consent is a serious offense punishable by law with a fine of up to $100,000. Meanwhile, psychologist Dr. Josel Miller says victims of these offenses are often ridiculed without thought given to their emotional and psychological well-being. She shared with SVG-TV News Today via telephone interview how persons can begin to protect themselves by choosing not to produce the explicit images or videos.
The taping of explicit sexual content, regardless if you believe that you're in a committed relationship or not, especially outside of marriage, there's always a high risk of such things happening. While persons may say that it was never my intention for something to be made public, you can't totally control all the variables when somebody else is also involved. Unfortunately, we have seen where these tapes are being leaked as a means of revenge, or persons, when they're angry, tarnish the person's character and image. I would say avoid taping these things. Secondly, understand the risk involved.
Dr. Miller said victims of cyberbullying, especially those who have had their images shared on social media of a sexual nature, will require counseling, which she said is an important step on the road to regaining normalcy.
If within that environment you feel that you cannot cope, it is too much, it is best sometimes to take yourself out of that space, if possible, even for a short-term basis. We have seen cases where persons feel the trauma was just too much. Do not think that suicide is an option.
The persons who experience such emotional and psychological trauma can then lead to things developing like post-traumatic stress disorder, depression, anxiety. Some persons might begin to have even social phobias and isolate themselves from people because the trust is to become such a difficult thing for them to actually deal with. So it's really important for persons who would have experienced any such thing that they get professional help from a psychotherapist, a psychologist, counselor, as well as have a support system in place that can really help to walk them through it.
Dr. Miller is advising persons to refrain from sharing images or videos of persons with explicit content, noting that oftentimes a victim's well-being is tossed aside for the social excitement and notoriety, which can cause lasting damage to an individual. Female prisoners at Her Majesty's prisons are the recipients of a donation of gift bags from Sir Optimist International, SVG. Founded on October 3, 1921, Sir Optimist International is a global volunteer organization that provides women and girls with the access to education and training they need to achieve economic empowerment. Today, President of Sir Optimist International SVG, Ikamola Laborde, handed over a quantity of gift bags containing toiletries and snacks to Cassandra McPhee, matron at the female prison, during a brief handing over ceremony. According to Laborde, her organization thought it fitting to provide the female prisoners with the gift bags for the Easter holiday. She noted that their donation was a token of their love, support, and appreciation for women throughout the world. In accepting the gift bags, Matron McPhee expressed gratitude to Sir Optimist International SVG on behalf of the Superintendent of Prisons, Timothy Hazelwood, and the staff at Her Majesty's prisons. She said that the timely donation will go a long way in helping to meet the needs of the female inmates.